So we have a few things going on that you've come here for. Yeah.
Yep.
Number one is left shoulder.
Correct.
Left shoulder. Number two is the right knee.
Yep.
And in terms of spine issues, before I get into it, do we have any spine issues going on?
Not that I'm aware.
Nothing that's bothering you.
Yeah. You know, sometimes when I'm in a massage actually session, sometimes I notice like a rotation of the disc also on the
Left side? On the left side. Okay.
Yeah.
Anything else?
No.
Okay. So we have a few things to talk about and go over. Yeah?
Yep.
Now, I'm going to recap a couple of things from our history. Turn this way just a little bit. We had an initial injury about 7 years ago that he mentioned, and 7 years ago breaking up a fight, hyperextended your shoulder.
Yep.
And just got on with life, everything was okay. About 3 weeks ago, you're in the gym working out, you start to feel that shoulder,
Yeah.
correct?
Yeah.
Now the knee, let's talk about the knee.
Okay.
You said there's a little bit of instability
Yeah.
in the knee, and can you recap about the knee again?
Yeah. So there's times when, like when I go up and downstairs,
Yeah.
I'll feel it kind of like it's just out of place,
And
unstable.
you noticed it when you were playing basketball, you said, right?
Yeah, about 5 years ago playing basketball, I was just running on the court, did a sudden stop, and kind of felt like it slipped out of place, came back in.
Okay.
Didn't really bother me much for a while, but
Okay.
then within the last probably like 6 months to a year, it's started affecting me when I'm sitting at my desk in the office, and
So now it's affecting work,
yeah,
not just play.
yeah. Now I'll just be
That's a
sitting
little more
down,
serious.
yeah, casually.
It's a little more serious now. Okay,
Yeah.
and then you said both going up and down the stairs bothers you.
Yeah,
Okay.
yeah,
Because typically when we're going over the knee, if someone says it bothers me going up, usually it's a femur issue. Someone says it bothers me more when I'm going down, usually a tibia issue. Now you're saying both.
yeah.
And the type of trauma you're speaking of is almost like an ACL got loose or something. But all of that is predisposed from whatever's going on in the back.
Okay.
And I did talk to you about the back, saying there was an old injury there,
Correct.
right?
Yeah.
And we were going back about 15 years. Yeah?
Yeah.
Of the low back injury.
Mhm.
And when I'm looking at, we're going to go over your x-ray so I can explain a little bit more.
Sure.
And in this work, as you know, you came here for a shoulder and a knee, really.
Yeah.
But we're evaluating the spine first because everything is connected.
Sure.
Yeah?
Yep.
And then we'll deal with the rest.
Cool.
Okay?
Yep.
Come over here and let's go over your x-rays, sir. Let's go ahead and talk about the AP film, and let's just get an overall presentation of what's going on here.
Sure.
Okay? First thing, we're going to zoom in, and we're going to go over way more detail in a bit. When we're looking at the spine, what do we see? We see that the pelvis or the foundation is tilted slightly on your left side, yes?
Yeah.
And you can see it curves a little bit with it. Not so bad though, but it's there. And then you can see the body compensates and comes back straight. And then right around that mid back, you can see there's a kink in there. Let me just zoom in here. You can see this kink in here,
Yeah.
right? And you're complaining of the left shoulder. Well, here's what I want you to see. Because of the kinking going on here, that's affecting the whole upper posture, upper extremity. Yes?
Yeah.
Okay. The second thing that it's affecting is this kink here is affecting not just the mechanics of the spine and the shoulder. Shoulder starts where? It starts in this wing bone, the scapula. And when we look closer at the scapula here, the wing bone, this should be superimposed onto this. It's almost like, as you said, the shoulder is out of its socket. Okay, and you can actually see that on the x-ray as well. Okay? The question is what caused it? And what we need to look at first is the nerve supply. Get the power onto the shoulder, number one. Number two, then we see, do we need to adjust the wing bone to keep it in, to make sure that the humerus has a good place to sit.
Okay.
So there's the wing bone, there's the humerus, it sits in there like this. Now, if we have, this is the wing bone here, we have what's called a glenoid fossa. It's a little fossa, a cavity where the humerus sits into. Okay, like that.
Sure.
Now, if we have, watch, if we have rotation of the scapula And that rotation can come from the kink, yes.
Okay.
As we have rotation of the scapula, look at the glenoid fossa, the cavity. As it turns, it's not sitting in there right.
Gotcha.
Then it's going to want to compensate and rotate in, and now the muscles are working off balance. Does that make sense?
It does.
Okay.
I've been having a stiff shoulder for a while. I give massages a lot.
Okay, got it. So that's good to know. I want to make sure you understand that because it's going to make the work a lot easier then.
Okay.
Okay? So let's go now down, or let's go up a little bit and follow it up. See, you can see the kink here, and then at your neck, it straightens out. We have a little wave, but it's good for all purposes.
Okay.
We have a little deviation of the right jaw we'll need to address and deal with as well.
Okay.
We'll take care of it since you're here. Now let's go down to the foundation. We have some digestion stuff going on, but it's not so significant. We can go over that later.
Cool.
Let's get into the foundation. We can see the hips are off alignment, yes?
Yeah.
We can see the tailbone is also tilted. So let's go to a different x-ray and let's look at what the numbers mean. And this is going to make a lot of sense now. So when we're looking at the foundation, we have 24 bones in the spine. Think of this as a 24-story building, and this is the foundation of your building. Okay? Now, 227, 232, 61, 63, and 3.3, and 10 millimeters here. What does all this mean? Now, when we typically look at the pelvis from a side profile, when we look at it, it typically sits on an angle. Okay? And what sits in here?
The femur.
The femur. And what does the femur connect and become?
The knee.
Correct. So
Makes sense.
we're taking it back to the foundation. Now, when it misaligns posterior back, I'm referencing the PSIS here. When it goes or misaligns back, the vertical distance will be larger. We call that a PI ilium. When it misaligns forward, the vertical distance will be shorter. 227, 232. 232 is the bigger number. Another misleading case here, guys. Check this out. So the right pelvis goes down, the left pelvis goes up. The right pelvis turns in. So watch. The right pelvis goes down, left one goes up, right one goes in. So your pelvis, your foundation favors to the,
Right.
but your spine goes to the, that's your disconnect.
Wow.
Now, here's the other piece of the puzzle. We have a leg length discrepancy of 10 millimeters.
Wow.
Now, this is what's misleading in your case. For a PI ilium on the right, if it's your right pelvis is the issue, and I bump it up, what's it going to do to the left side? Make it go down more. If it's the left side that's misaligned, I don't know till I examine you.
Sure.
Left side is misaligned up and out. I bump it down. What's going to happen? Makes that more. So what is that telling us?
One leg shorter.
Well, yes, but the answer is not in the pelvis. The answer is somewhere in your sacrum. So there was an old tailbone injury. This is why I was asking you about an old injury.
Oh, okay.
And I can see it right there. I'm going to show you an x-ray without the lines.
When you have a cyst above the tailbone, does that count as an injury?
Yes.
Oh, it does. Okay, so I did have a cyst.
Okay,
Yeah, tailbone cyst.
come on.
Forgot about that until you mentioned the
That's
tailbone.
important. You see, guys? Okay, let's talk about that.
Okay.
When was the cyst?
Ooh, maybe 2002, I believe.
Okay, and how many years did I talk about earlier? Just
15 to 20, yeah.
Okay.
So kind of.
So how did you get a tailbone cyst?
I don't know how I got it. I just know that one day I was driving and it hurt real bad. I went to the ER. They cut it open and released the sacrament,
The fluid?
the fluids, yeah.
Okay. So let's talk about a cyst real quick, guys. A cyst, wherever it is in the body, okay? Every cell has a specialized function, right? Hair cells make hair.
Sure.
Thyroid cells make thyroid hormone.
Okay.
Bone cells make bone. Every cell has a specialized function. Liver cells make all different types of things. The point I'm making is when the cell is either lacking communication or information or power, it can start to produce other byproducts. And a cyst is common. What a cyst tells me, as I was trained, If there's a cyst anywhere, it could be an ovarian cyst, a liver cyst, and I'm not talking about malignant bone cysts and things like that. It could be a cyst in the wrist, a ganglion cyst behind the knee, tailbone. It means something is going on there. Something is off in that area.
Gotcha.
Now, does that make sense?
Yeah.
Okay. This is what stands out to me right here, guys. I'm going to highlight it a little bit. Now, when I go a little bit closer here, that screams at me right there, guys. That's an old injury. Okay, and what's interesting is that whatever's going on there, it's causing this sacrum to tilt. Let's go to a side profile and see. Making sense now, Mo?
Oh, yeah.
Yeah.
Does it mean I'm going to die? I'm just kidding.
Not by my hands, bro.
Right.
So we want to see a smooth curve. There's something here. There's something there. Tailbone and S3 or S4. That's probably where we're going to start, somewhere there. Once we have that sorted out, then we have to deal with your L5. So I'm going to zoom out a little bit. You see this L5?
Yeah.
You have a good disc there. That's the good news, okay? These are fantastic discs. I was expecting them to be less.
Okay.
But the shape of that disc tells me the time or rough time period of the injury. That's why I asked that.
Sure.
Okay. So we said PI ilium, AS ilium, 63 and 61, 2 millimeters, a little bit of rotation of the sacrum. But we need to get this under 7.
Okay.
So I don't know that that's going to happen with a pelvic adjustment. That's not, because the numbers don't support it. I'm going to see what we can do with the sacrum. I'll probably see you a few times. We'll probably need to re-x-ray the low back to see, and then I may have to give a heel lift. Okay, in order to keep things balanced.
Okay.
And I know this is going to sound a little weird, but if we don't balance your foundation, your shoulder's never going to get fixed.
Sure.
And walk a straight line. You got a whole story on your back, brother.
Oh, yeah.
You got a whole story on your back. Walk towards me, please. Keep walking, please. And look straight ahead when you walk, several times back and forth. Just your normal walk, sir.
Okay.
Good. Yeah, so you can see he tilts on that left side. And if you watch his left ankle, his left leg, it tells a lot of the story. Can you take your socks off for me, please?
Yeah.
Your feet tell a good story about your foundation. Just regular walking.
That probably explains my dancing, huh?
You're dancing?
The lack of?
All right, well, we'll get it. You want to go back on the dance floor? We'll get you back out there.
Right.
So when you watch his feet, you can see he tilts on that left side, and he kind of swings it. But when he's swinging it, he's not swinging it all the way through because of that dropped leg on the left side. Okay, let's have a seat over here on the table, please. Let's get started. Base of the neck. You really do got a whole story on your back. How long did it take to do all that?
About 24 hours.
One shot?
No. It was about 6 different settings, 4 hours each.
Okay, so as I'm running the meter up the spine, the first thing I'm getting is around C6, base of the neck, C7, left side, 10 points, 12 points. As we go up the spine, up top is good, base of the neck. Now, the shoulder is under 100% neurological control, controlled by the brachial plexus, nerves that come out of the neck, power the sits muscles or the rotator cuff muscles, and kind of hold it in place and give it that power and information it needs. Why I'm saying that is, whenever there's a shoulder issue, we're always going to start with the spine first to make sure the power is there, okay?
Sure.
And I am getting about 6 points, 7 points, 6. Left side, around T4, T5, right around that kink area I was talking about.
Yeah.
Let's continue. Who's this girl?
ISIS.
ISIS.
Oh, yeah.
What's up with ISIS?
Yeah, she's busy with Horace.
All right. Now I'm getting down low as we talked about, S3, S4. So we're getting it down low, we're getting it in the mid-back area here, and I'm getting the base of the neck there. Let's go ahead and run the fingers. And obviously it's a little bit harder to see with his artwork, but right about here is where it starts to orange peel. And I thought it was this first one, but it actually goes down to the second one. You feel this one here?
Yeah.
Okay. More tender when I push here or here. This one, that one.
That first one.
This one or this one.
Oh, probably that one.
Yeah. 1, 2, 3, 4, 5, 6. And that also has a little bit of control to the stomach area, by the way. 6. That one
Yeah.
or that one?
More the bottom one.
You need to zoom in on this one. Okay?
Yep.
So we're going to be right here. Scoot forward, please. Let's check the movement in the hips. Okay. Feet together. Open and close the knees. Open and close. Open and close. Left side only. When he does the left, the whole right wants to shift. Right side only. When he does the right, the whole left wants to shift also. So what does that tell us? We're going down low. Now let's come back towards me here. That's 5. That's S1. Tender, yes?
Yep.
S2. S3. S4.
Yep.
Come back slowly towards me, please. So we need to start down here. Yes?
Yep.
S4. S4, T6. Now let's feel what's going on with the neck. Okay. Bend right, bend left. Bend right, bend left. Doesn't want to move as well to that left. Right there. Do you feel this right here?
Yep.
Okay. Now, this is 7. This is 6. Come over here, you can see. Start again here. This is 7. This is 6. Both of them aren't moving. Let's go down to 1. 1 is moving. We're going to start here at 7, okay?
All right.
C7, T6, S4. Then we're going to recheck everything. But before I even do any of that, let's check the movement of the shoulder.
Sure.
I'm going to do circumduction, just basically like a baseball style pitch. I want to feel how smooth that is. You can feel that clicking and grinding, yes?
Yep.
Now let's feel the other side here. This one hurts more,
Oh, yeah.
but the right one is worse, by the way.
Is it really?
Mechanically.
Oh, wow.
So this is moving. Tell me where it hurts when I do this. Say
Okay.
when.
When?
There.
Yep.
Okay. How about this side?
I feel that rotation. It doesn't really have any pain.
No pain, but you feel the
but I can feel that
mechanics.
mechanics, yeah.
Got it. Okay. Let's get started. We're going to go on the orange table. Senor, chin up, please. Relax the shoulders down, 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 down. Hands forward, please. Good. Hi. Hi. Bro, I've seen a lot of tattoos, man. That's a first. That's definitely a first. Deep breathing now. Jokes aside, let's get to work. Deep breath in. All the way out. There it is. Keep going. Now, we said it's dropped. We have a dropped leg on the left, so I need to torque up on your sacrum, okay?
Yep.
Make sure you don't slide. I gotta torque that. Ah!
Oh, yeah.
Home run.
About that.
Thank you, Sakina. Whew. That was deep, brother. 6. 6. Gotcha. Now, just from that, Mo, we'll walk it off a bit. Just from that, you'll tell me what's different, okay?
All right.
Good stuff. That was deep.
Just walk straight lines.
Just walk straight, bro. Keep your head up though, please. It's different already. Good. Good. Have a seat over here, please. We've got to put a stabilization or a seatbelt on. Let's put the seatbelt on. Hand down. Thank you. Now, C7. Chin down. Good. Good. Gotcha. Sit up straight for me, please. Now, let's run the meter on your back. Still a little flutter right there. Let's go on the gray table. I gotta set it deeper. So it's one thing when we have an injury that affects our ability to play and work out, and all that's one thing. Slide up a little bit more. It's another thing when we can't even sit and do our job, you know? Or stand and do our job. Lift your chin up. There we go. C7. That's it. Did I get your chin on that?
No. You're good.
So the first good part is this easier to sit like this?
Yep.
Because you're sitting straighter now.
Yeah, so that's forceful.
Home run. Home run. All right. Now let's check the movement of the shoulder. Let me do the work.
Oh.
Better, but I still have to set it. Let me do it.
There you go.
Now, let me do it. Pretty cool. Different?
Not as painful. Yeah.
10%?
Yeah.
10% less?
Probably, yeah. What about that?
You want to set the scapula, the wing bone first. Give it a day or two to get used to it. Then we set it.
Okay.
Bring your left hand behind your back, please. Good. I'm going to place my knee there. Just relax your shoulder right there. Good. And I'm going to go ahead. We're going to set this on full expiration. Take a deep breath in. Blow it all the way out. A little more like that, okay? You got to give it to me. Try not to help though. Good. And there you go. Gotcha. I'm going to use the machine, break up some scar tissue. So down the spine, along the spine, down the spine, along the spine, left hand behind the back, let me hold it, let me do it, and I'm just getting in there to break up scar tissue. Right hand behind your back, sir. Walk it off, please. Move your shoulder around. And as you're walking, tell me what's different so far. Doesn't matter good or bad.
Yeah, well, I mean, even walking, I feel straighter, firmer.
Walking more smooth. That's
Yeah.
the first thing I see. How's that shoulder right now?
Shoulder feels good.
What's different?
Although I do still kind of feel somewhat, but a lot less
Where do you feel it right now when you do that? Show me.
when I do this one.
Point to the spot.
Right. Right here.
Okay, so let's break up the scar tissue now there. Go on your back here. The biceps tendon sits in a little groove right here. right there, that's the groove.
Okay.
So when you hyperextend in it, this probably came out a little bit too. There's a ligament called the transverse ligament.
Okay.
So we're just going to work out that scar tissue right there. Make a bicep muscle.
Okay.
Make a muscle. Resist. Pull.
Resist.
Pull. So I'm doing this so I can actually get to that tendon, right? There. Relax. Okay. So this is where we need to be. If anything is too much, you tell me, I'll stop, okay? Otherwise, I'm going deep. Now pec minor. Try that now, sir. Sit up for us.
Okay, so now I would feel it there.
In the biceps.
Yeah.
And the deltoid insertion.
Yeah.
Okay. But it's not in that inside spot now.
No.
It's shifted, right?
Yeah.
Okay. So what is this telling us now?
That is moving.
Scar tissue.
Scar tissue.
Scoot to the right. Just a little bit more. Five, four, three, two. That's where we're going to start. Move it again. Not bad.
This area feels better.
Stand up for me, please. Squeeze my hand. Squeeze hard. Hands are solid. Squeeze. Tiny little bit here on the scaphoid bone. Tiny bit. Lunate, scaphoid. There. That's it. 5 times. Squeeze hard. Squeeze. Turn. Ears.
Oh.
You're all set, brother.
Yeah. Nice.
Welcome to the office.
Appreciate it, man.
You got it, man.